Good morning, everyone. Thank you for joining us. It's great to be back in my hometown of Union City, the place where I grew up, where I went to school, place that I started my life in public service. And we are here at Sugarman's with its two proprietors, which is a local pharmacy that has been serving Union City residents for decades, alongside its co-owners, Drs. Vanessa Rodriguez and Dr. Gabriela Bernat. I want to thank them for hosting us today, as they have clients coming in and out. We appreciate them helping us set the framework for what we're doing. Uh, we also have Laura Waddell from New Jersey Citizen Action, and Doreen Monks, a local senior who relies on Medicare Part D for her prescriptions. We're here today to announce landmark legislation to reform an industry known by three letters: PBM. PBMs, or pharmacy benefit managers, are a little known but critically important part of our prescription drug supply chain. Ask any patient, and they could probably name their pharmacy, like Sugarman's, their health insurance, and maybe even the pharmaceutical company that manufactures their prescriptions. But most patients don't know that PBMs are the crucial link that connects them to those three groups I just mentioned. To understand why they occupy this vital place in the industry and why we are in desperate need of reform, we need to start at the beginning. PBMs were created in the 1960s, around the time when health insurers started covering prescription drugs. As the cost and the complexity of the drugs grew, PBMs tightened their grip on the healthcare industry. How? By acting as middlemen. Today, PBMs derive their power by determining which drugs get covered by which insurance. As a result, PBMs have become gatekeepers, deciding which drugs many patients can afford. Worse still, PBMs link their own compensation to the list price of a drug. That's right, PBMs earn their profit as a percentage of the medication's sticker price. When choosing between identical drugs, time after time, PBMs opt to cover the more expensive one. Why? Because it means more profit for their bottom line. You can see a perfect example on this chart that shows you the difference between a list price and the amount that ultimately, between a biosimilar A and a biosimilar B, one is 3,288, the other one is about 1,557. That's a huge difference, especially if you're a consumer. Humira is a medication designed for patients afflicted with crippling rheumatoid arthritis. Yet, despite the incredible benefits it receives, a treatment plan can cost upwards of $80,000 a year. That's good news for consumers. The good news for consumers is that Humira biosimilars are being launched, which should make the treatment more affordable for patients who desperately need it. But between covering an expensive biosimilar or a cheaper version of the same drug, PBMs choose the more expensive one because it significantly increases their profits. That, in a nutshell, is why Congress must act with urgency to reform the PBM industry. In their role as middlemen, they have a vice grip on our healthcare system, creating warped incentives that lead them to cover more and more expensive drugs. Through their actions, PBMs leave patients on the hook for higher costs when they go to pick up their prescriptions at the pharmacy counter. And I'm sure that our pharmacists hear it firsthand from their consumers that come in. It's a pervasive problem that requires a bold and effective solution, which is why I've introduced legislation, the Patients Before Middlemen Act. This bipartisan bill, which I'm leading alongside my Republican colleague, Senator Blackburn from Tennessee, would curb some of the biggest abuses that PBMs engage in. Our bill would simplify the current system of rebates, opaque administrative fees, and other complicated schemes. It would de-link the PBM compensation from drug prices while helping to drive down costs for seniors on Medicare. Under our bill, instead of being paid a percentage of a drug list price, PBMs would be paid a flat fee for their service. In doing so, the Patients Before Middlemen Act would better align profit incentives and inject more openness and competition into an industry that thrives on the lack of transparency. As an enforcement tool, my bill would require PBMs to pay the federal government any amount that they collect over their agreed upon flat rate. Our legislation shows that when it comes to pharmacy benefit managers ripping off hardworking families and seniors, we stand together across party lines on protecting patients and increasing their access to affordable prescriptions. So let me conclude by saying it doesn't take a PhD in public health or economics to realize that the current status quo on PBMs is unacceptable. For too long, they have worked behind the scenes to reduce competition and jack up the cost of prescription drugs in America. And as Congress looks to address the PBM industry in upcoming legislation, I'm proud that my bill is the marquee piece of a PBM package the Senate Finance Committee will be voting on tomorrow. Make no mistake, our Patients Before the Middlemen Act deserves to be signed into law. Why? Because when residents come to pharmacies like Sugarman's, they deserve to know that their drug costs aren't lining the pockets of a PBM company they've never heard of. Seniors and other patients deserve a healthcare system where shadowy middlemen aren't working against their best interests. We have a responsibility to bring down the skyrocketing cost of prescription drugs, which is why I will not stop, I will not rest until the reforms included in our bill become the law of the land. That's what patients all across America deserve, and it is hopefully what we will soon be able to achieve. Let me just very briefly synthesize that in Spanish, and then we'll call on Vanessa Rodriguez and Gabriela Bernat, who are the co-owners of Sugarman. Estamos aquí en Sugarman, en una farmacia que por décadas ha servido a la comunidad en esta zona, incluyendo a este servidor, esta es mi farmacia. Y estamos aquí para anunciar la ley que mañana en el Senado vamos a tener un voto, que es un esfuerzo para reducir el costo de las medicinas recetadas, sobre todo el Medicare. Tenemos un sistema donde hay una organización que se llama PBM, que son los que manejan el intercambio entre las medicinas recetadas y las compañías que dan el seguro para esas medicinas recetadas. Y ellos ganan su dinero por consiguiendo 1% del precio de la medicina recetada. Pero ¿qué quiere decir eso? Quiere decir que cuando hay dos medicinas recetadas para el mismo propósito, ellos escogen el más caro. ¿Por qué? Porque el porciento del más caro le beneficia a ellos más que el porciento de que es menos caro. Pero para el paciente, el consumidor que viene aquí a Sugarman's o cualquier farmacia, el costo es mucho más alto. Y eso es lo que queremos eliminar. Mi ley, que es una ley bipartidaria, tiene 3 republicanos y 3 demócratas oficiándolo. Mañana en el Comité de Finanzas del Senado va a tener un voto para eliminar ese incentivo perverso que actualmente crea un costo más alto para los consumidores y que nos puede dar medicinas recetadas que son mucho menos costosas y mucho más mejor para los constituyentes y los pacientes. Y con eso, let me introduce 2 of our co-owners here who every day they hear patients at the counter talking about their challenges. Thrilled that they have agreed to host us here. Vanessa Rodriguez and then Gabriela. Vanessa.
Buenos días a todos. Primero les quiero dar gracias al senador Menendez por ser parte de esta comunidad, por darnos ayuda, no solamente a nosotros, a todos los pacientes. La legislación que está hablando es sobre el costo de las medicinas, que se le hace tan difícil a nuestros pacientes, a todos los mayores, poder escoger entre comprar un plato de comida o poder pagar su medicina. Es triste ver, y nos pasa a nosotras diariamente, como le tenemos que decir a un paciente que el costo de un anticoagulante le sale a $200 al mes, cuando es una medicina que es para su vida y no tienen el recurso para poder pagarla. Entonces queremos que esto se pueda salir a la luz y que podamos ayudarlos a ellos y que esto no pase para poder ayudar a nuestra comunidad, a nuestros pacientes, a su salud, que es lo más importante.